PCOS and PMOS are the same thing. It's not that in May this year the name was changed from PCOS to PMOS. PCOS means Polycystic Ovarian Syndrome, while PMOS means Polyendocrine Metabolic Syndrome. The Polyendocrine Metabolic Syndrome just gives us a better understanding what is happening when somebody is diagnosed, or when we say somebody has Polycystic Ovarian Syndrome. Now, about 8 to 13% of women in their fertile age do have this syndrome, and it can affect us because it can lead to infertility, and that is one of the things that worries a woman, especially people that are from Africa. Now, what is the cause? I have PCOS. Did I commit a crime? What did I do? And all that. I want to, as I have said before, all these are medical conditions. It is not a personal failure. So in PMOS, the cause is really idiopathic. That is what people will say unknown. I cannot just tell you it is genetic. I cannot just tell you that no, it is unknown. But what has been found, a lot of researches have been done, and say there's an interplay with genetic predisposition. That means there's some genetic predisposition. There's some genetic factors that can affect this. People can say it is insulin resistance, and people can also say that the environmental factors also come into play when it comes to, but it is idiopathic. But all these genetic, environmental, insulin resistant, all of them woven together can lead to polyendocrine metabolic syndrome. Now, as the name says, it has to do with the endocrine part, and there are some metabolic changes that happen. When we talk about metabolic, you're talking about the chemical changes that happen in your cells and in your body. So now, the endocrine, all those chemicals that control menstruation, controls hair, controls everything that controls how you look as a woman and how a man looks as a man, those chemicals in our body that control them, those are the things that are really come into play when it comes to the presentation. So now they will tell you that they say one want to diagnose is now, no, the person will have oligo ovulation or ovulation. That means the person will have reduced ovulation or does not have ovulation at all. That's why you see some of them will not be menstruating at all, or some will be menstruating once every 6 months, because it's when you ovulate that you menstruate. Without ovulation, you cannot menstruate. So you have to menstruate, you have to ovulate first, the menstruation comes. But now they are not ovulating, so they cannot menstruate. So that you have that. Then these endocrine problems will also be coming. That means you look at their hormonal profile. That's where it comes. That's where hormonal profile comes. You see that there's a problem. I don't want to go, but one of the problems, I don't want to go into all, but one I know that you will understand is that the follicle stimulating hormone is usually low. You know that is what causes the follicles to develop. So that one is low. So you see, they are not going to have follicle that will ovulate. That will ovulate because their follicle stimulating is low, so the follicles will not develop. Then another thing, then so when you look at this thing, some people can see some things that looks like a cyst. It's not really a functional cyst and all that, but what it just shows is you show immatured follicles that have not really developed and that stopped. Will say it has arrested. So when they look at do an ultrasound, that's what they will be saying. And so when two of this come into play, they will not say, oh, this person has polycystic ovarian syndrome or PMOS. That's what they will not say that this person have. And how do they present? As I've said before, they don't have menstruation. One of the most things is that they don't menstruate regularly. Now, there are some people that menstruate every 35 days. This one is regular. You say, oh, it's long, but it's regular. But this one, maybe 6 months, they will not menstruate. 3 months, they will not menstruate. 1 year, they will not menstruate. So they will not have menstruation. They will not be ovulating. And now, guys, I talk about the hormones. Because of that, they will not have a lot of hair. The books will tell you that they have the male distribution of hair. You know, men, they have beards, they have hair in their chest. Most women don't have beards here. Most women don't have hair in their chest. So some of them now start having beards here, having beards in their chest. Then again, they will have a lot of pimples. Some have acne, that's all called acne. Have some acne. Then in most cases, they are usually on the big side. But we have seen some cases that are not big, so they are usually on the big side. So those ones will say, we'll call them central obesity, but their obesity is usually around the tummy. So that's why, because this is central, your tummy side is your central part, so they usually have central obesity. Another thing, they usually have they're resistant, insulin resistant, so they usually are diabetic. So most times, again, when you control the diabetes, you see that ovulation will occur in those ones. So some are some they have pre-diabetes. It's not all that have that. So those are the clinical presentation. If you are not seeing your period, see your physician. If you are not, so when all these signs are there and she's not ovulating, she's not seeing her menstruation, it is time for you to seek help. Now, as I said before, in most of all these things, what do? You need to go and see your physician. You need to see your physician. Again, a thorough history is going to be taken from you. Have the person been pregnant before? We're going to do a thorough history. We're going to do a lot of investigation, which will include your hormonal profile and all that. I'm not going to be telling you all because this is just for education. So they're going to do your hormonal, do a thorough history. That thorough history, a doctor that does not take thorough history is going to make a mistake somehow. So you need to do a thorough history. Then you need to investigate the person. Now again, concerning investigation, there are some people say, oh, doctor, come to party, or you want to go meet the doctor, and the doctor say, oh, you did hormonal profile 2 years ago, and the doctor is telling you to repeat. You say, this doctor want to eat my money. No, please, we doctors, we don't use yesterday, we look at today, because your body must have changed. So you do all of the investigation, they'll do examination for you, and then